Hello, my name is Brian Ellison, and I am a current student of the Herzing University online campus. My agenda today is to present to my audience a informative speech on medical coding and what it takes to own your own business as a certified RHIA remote medical insurance and billing coding specialist by working from home. Basically, this topic is about how does a medical insurance billing and coding works in the medical field. Well, first I want to start off by saying that the ICD-9 is a way to classify diseases and other health issues that are recorded on many types of medical records that are diagnosed by doctors, providers, dentists, and other specialists. The diagnostic codes are listed in the ICD-10 manual by numbers. The medical coder job is that they must review the diagnostic codes that are listed on the doctor medical charts and convey them onto the 1500 outpatient claim form and the UB04 inpatient claim form once the diagnosis is confirmed and the ICD-10 manual. According to Benokov of the Health Unit of the WHO, which stands for World Health Organization, the application of the ICD-10 of the dentistry and stomatology, which is another branch of the ICD-10 coding of all of those items of specific interest in regards to the oral pathology, whether it's common or rare conditions or otherwise. The initiative advantage is discovering the numeric classifications without using the original parent volume. Dentistry, medical coding have their own set of ICD-9 diagnostic coding. The medical coder must then review the procedure terminology that is listed in a doctor's medical charts or records in order to convey the procedure and the 5 numeric procedure coding that are listed in the CPT manual, which the CPT stands for current procedure terminology, in accordance to the medical charts that they're reviewing. According to the World Health Organization, all member states use the ICD-10 medical coding for which they have conveyed in 2 out of 3 different languages throughout 117 countries in the world. According to Sydney of the University of Snow, Connecticut, is another standard healthcare terminology that includes comprehensive coverage of diseases, clinical findings, and other outcomes that providers for the core general terminology for the electronic health records, and contains 357 concepts of unique definitions and formal based organized definitions into hierarchies. Most certified medical coding and medical billing and coding specialists would prefer to work from home remotely from a company such as a hospital or a doctor's office. Most medical codings and billing specialists such as myself have to get up early in the morning, every morning, to beat traffic in order to make it to work on time. Then there's always politics whenever you go to work when whichever another reason most medical insurance billing and coding specialists would rather work from home. In order to become a medical coding specialist, you must become certified through the RHIA, and must have the concept of medical coding and billing experience as well as the concept. And furthering your education by earning an associate's degree in health information management in order to be eligible for the RHIT, and then the bachelor's for the RHIA, whichever the medical coding if you desire to work from home to prefer, but of course the bachelor's is higher. The RHI is a higher certification, and you will be reimbursed more. According to AHIMA, an individual who desires to become a medical insurance billing and coding specialist working from home from a big company or a medical facility must sign a written telecommunication agreement that illustrates defining telecommunication as a management option rather than an employee benefit, exceptions relative to the confidentiality issues, ownership issues, time frame for working at home, on-site availability, and reference material, and HIPAA regulations and guidelines. One must have the concept of medical coding and understand how to read doctor notes, charts, and when reading those charts, rendering services to the patients must have knowledge of the medical terminology in order to convey doctor notes onto the procedures. Let's see. According to the American Medical Association, failure to comply with the Health Insurance Portability and Accountability Act (HIPAA) can result in civil and criminal penalties. If a complaint describes an action that would be violation of the criminal provision, may refer to the complaint to the Department of Justice (DOJ) for an investigation. Having the education, experience, and concept of the medical billing and coding, medical insurance billing and coding field is what it takes to be in order to be a successful entrepreneur as a medical remote coding by working from home remotely for a big shot company or any kind of other medical facility. So in order to do that, you again must have your bachelor's degree first, and then earn a certification through the AHIMA organization out of Chicago, which is the RHIA, which stands for Registered Health Information Association, which you must first have a bachelor's degree in health information management before you're considered eligible to take the test for the RHIA. Once you earn all those credentials and you have the experience as a medical insurance billing and coding specialist, then you will be eligible to set up a portfolio and start your business from home.